In the recent years, the United States has reported a dramatic increase of syphilis rates, with congenital syphilis being the most prevalent subgroup, growing by 40% from 2017 to 2018. Hi, everyone. My name is Erica, and today, Blake, Nika, and I will be discussing how syphilis is currently affecting members of the San Joaquin County. Syphilis is a sexually transmitted disease, or more commonly known as an STD. STDs are passed from one person to another through sexual activity, including vaginal, oral, and anal sex. STDs don't always cause symptoms, which makes it harder to identify if an individual has an infection. This is why we encourage safe sex and getting tested for STDs if you are having sex. Though there are many STDs, we'll be focusing on syphilis today because of its resurgence in this county. Syphilis is caused by contact with bacteria, Treponema pallidum. The bacteria, as pictured, is a spiral-shaped bacteria that is transmitted through all forms of sex between individuals. In pregnant females, the bacteria can also pass through the placenta and affect the developing fetus, which is called congenital syphilis. Syphilis is a progressive disease that is categorized into 4 different stages: primary, secondary, latent, and tertiary. Each stage has its own signs and symptoms. If an individual with syphilis remains untreated, the individual can pass through all 4 stages and eventual death. The onset of syphilis after direct contact with the bacteria can begin anywhere from 10 days to 3 months. Because the symptoms of syphilis can take some time to develop, we encourage all individuals to engage in safe sexual practice with condoms, getting tested for STDs or HIV, and talking honestly with partners. So the reason we are discussing syphilis today is because in 2017, the rates of primary and secondary syphilis in San Joaquin County increased by 44% with a total of 381 cases. That same year, San Joaquin County was ranked the 2nd county in California with the highest number of syphilis cases. The spike in rates from 2016 to 2017 demonstrates the lack of sexual health education and a general lack of testing available to highly susceptible or at-risk populations in San Joaquin County. The following year, San Joaquin County ranked 30th in the United States for the highest number of syphilis cases. However, with a few successful interventions hosted by the San Joaquin Public Health Department, such as homeless outreach events where rapid syphilis testing was provided, San Joaquin County has seen a small decline in primary and secondary syphilis cases. However, congenital syphilis, which affects the child or the infant, has only continued to rise throughout the years. In 2017, San Joaquin County had 15 cases of congenital syphilis, and in 2018, the cases doubled to 31 cases. The graph on the right shows how syphilis continues to steadily increase in the United States throughout the years. So syphilis is also known as a great pretender because the signs and the symptoms of the disease are indistinguishable from other diseases. However, its most characteristic sign is a chancre, which is also shown in this picture. So the first stage of syphilis is called primary syphilis, and it's defined by painless, firm, and round ulcer-like lesions found at the site of infection, namely the genitals, anus, and the mouth. Direct contact with these infected sites will likely cause a syphilis infection. The chancre lasts 3 to 6 weeks and will usually heal on their own, regardless of treatment. However, if the person does not get treated, the infection can progress to stage 2 syphilis. So secondary syphilis is known by a rash, and the rash usually does not cause itching. The characteristic rash of secondary syphilis may appear as rough, red, or reddish brownish spots, both on the palms of the hands and on the bottoms of the feet. The skin rashes on certain parts of the body can represent different diseases, which makes syphilis even more challenging to identify this late into the stage. If the rash or sores remain untreated, the infection can progress to latent or stage 3 syphilis. During the latent stage of syphilis, the individual, despite testing positive for syphilis, does not manifest any symptoms or signs related to syphilis. During the early latent syphilis stage, the individual was exposed to syphilis within the last 12 months and may be given a single dose of antibiotics as treatment. During the latent syphilis stage, the individual was exposed to syphilis more than 12 months ago and may be given multiple doses of antibiotics as treatment. So in the tertiary phase, I want to point out that this stage is rare to develop and is the last stage of untreated syphilis. An individual can undergo this stage even after 10 to 30 years of syphilis exposure. In the blue box, we see guma, and guma is a soft tumor-like growth of the tissues that occurs in people with syphilis. It most often occurs in the liver, but it's also seen on the skin, bones, and other internal organs. The syphilis pathogen can also invade the heart wall and cause it to become inflamed, which is known as aortitis. The inflamed blood vessel can rupture and cause internal bleeding and strokes if not treated immediately, and it can result in death. Syphilis can also affect an individual's nervous system at any stage, but the symptoms are not as severe until the tertiary stage, in which an individual's stride and memory becomes impaired. Tabes dorsalis is a condition in which an individual experiences muscle weakness, especially to the lower legs, which can make it difficult to walk. And that concludes the 4 stages of syphilis. And now I'm going to discuss a more prevalent type of syphilis in San Joaquin County. And that's congenital syphilis. So in San Joaquin County, public health officials identify maternal risk factors of congenital syphilis as no prenatal care, methamphetamine use, and homelessness. Congenital syphilis is an infectious disease that occurs when an expecting mother passes the syphilis bacteria to the fetus. Now, this can occur through the bacteria crossing the placenta, but the infant can also come into contact with the bacteria with the infected lesions during vaginal birth. But this transmission risk is less common. If an individual gives birth to a child with syphilis and is not immediately treated, the health consequences are extensive, as a child can have bone deformities, nerve problems, among other things that Nika will be discussing. Every case of congenital syphilis is preventable with proper health access, prenatal care and testing, safe sex and sex education, and to reiterate a statistic mentioned earlier, cases of congenital syphilis in San Joaquin County doubled in 2018, and public health officials estimate that they will continue to increase. Now, next, Nika will be talking more in depth about congenital syphilis.
Thank you, Erica. So as she mentioned, the bacteria crosses the placenta, and complication occurs as the bacteria crosses the placenta, affecting both the placenta and the umbilical cord, where the placenta would grow bigger while the umbilical cord gets swollen. And this can affect how the placenta and the umbilical cord work together to support the baby in the womb. The complications during pregnancy include miscarriage, when a baby dies in the womb before 20 weeks of pregnancy. And then if the baby dies in the womb after 20 weeks of pregnancy, that will be stillbirth. It could also cause premature birth, or when the birth happens too soon, which is before 37 weeks of pregnancy. And the baby can also be born weighing less than 5 pounds, and that will be called low birth weight. Right. Now, congenital syphilis can also cause problems for your baby at birth. Here are just some of the most common complications. We have jaundice. This is when the baby's skin and the white parts of the eyes look yellow, and this is caused by the buildup of a substance in the blood called bilirubin. If the baby is born with congenital syphilis, his liver may not be developed enough to remove bilirubin on its own. It can also cause anemia wherein the baby does not have enough healthy red blood cells to carry oxygen to the rest of his body. It can cause meningitis, which is an infection that causes swelling of the protective layer surrounding the brain and the spinal cord. And the worst thing that could happen is neonatal death. This is when the baby dies in the first 28 days of life. In some cases, congenital syphilis may not affect the pregnancy and the baby may seem healthy at birth, but congenital syphilis can cause serious lifelong health problems later in life if not treated right away. Some of these health problems include bone pain and deformities, such as saber shin or the malformation or bowing of the tibia, saddle nose, and Hutchinson teeth, wherein the teeth are smaller, they're more widely spaced than normal, and they're notched on the biting surfaces. It can also cause vision problems such as blindness or hearing problems such as hearing loss. And there could be problems with the nervous system, including having paralyzed arms or legs and seizures. There could be developmental delays wherein the child doesn't reach developmental milestones when expected. This would include sitting, walking, talking, or even having social skills. Now, it is important to know that these complications depend on how long you were infected with syphilis during pregnancy and if and when you get treated. Right now, when do symptoms appear? Since we talked about the different stages of syphilis for women, um, for the symptoms that would appear for children or for babies, not all of them would have symptoms at birth, but they may develop symptoms over time. There's early congenital syphilis and late congenital syphilis, where usually it could appear between or like symptoms can appear usually at 3 to 14 weeks of age, and then it could appear up to 5 years of age, and that will be early. If it's more than 5 years of age, that will be late congenital syphilis, and usually it can remain undiagnosed until adulthood. Now, how do we prevent congenital syphilis? Well, the only way to prevent syphilis in newborns is for the mother to not have syphilis before or during pregnancy. Basically, the baby will not get congenital syphilis if the mother is free from syphilis. Now, some of the factors that can increase the risk of acquiring syphilis would include engaging in unprotected sex because of the exchange of body fluids between partners, having multiple sexual partners, and this also includes men who engage in sexual activity with other men or even with women only, having HIV because the virus compromises the immune system, and so there's higher chance of contracting infection as the immune system gets weaker. Another risk factor is methamphetamine use. Studies have linked meth use with increased sexual partners and increased chance of having unprotected sex. And as we know by now, these two factors increase the chance of getting syphilis. Homelessness is also a risk factor because of the higher number of people having multiple sexual partners in that community. And lastly, no prenatal care. Women who are uninsured or underinsured and those with substance use problems are more likely to receive inadequate or no prenatal care, and this increases the unborn baby's risk for congenital syphilis. All right, now, how do we prevent syphilis? And here are just some ways to prevent syphilis or even other sexually transmitted diseases. The best way would be sexual abstinence, which means not having sex, but it is always not possible. But if you think that you might have syphilis, it is best to avoid sexual activity until you've talked with your doctor. Now, if you do engage in sexual activity, be sure to follow safe sex practices, such as using a condom. If there are lesions in the genital area, make sure they are properly covered with a condom. Also, do not use recreational drugs, especially injectable drugs, since dirty needles that are contaminated with blood could be potentially used. Syphilis can also be prevented by getting tested and treated right away. The sooner you're treated, the less likely for you and your baby to have complications from the infection. It is also important to have open conversation with your partner and ask your partner to get tested and treated as well. Because after treatment, you're no longer infected, but you can still get infected again if your partner is left untreated. In the previous slide, we learned as well that many cases of syphilis happen in women who don't get regular prenatal care. So if you're pregnant, going to prenatal care checkups should be a priority, even if you're feeling fine. This way, the provider can ask questions and see if you may be at risk for syphilis and other infections that can affect your pregnancy. If you're at risk for syphilis, the doctor will order a blood test to see if you have the infection. The CDC actually recommends syphilis screening for all women at the first prenatal visit. They also recommend repeat testing um, for pregnant women who are at risk of contracting syphilis or those who live in a community with high prevalence of syphilis. And repeat testing will happen early in the third trimester between 28 and 32 weeks. And then there's going to be a repeat testing again at delivery. Now that we talked about prevention, I will now turn it over to Blake to discuss the treatment.
Thanks, Nika. What's great news about treatment is that it can be treated and diagnosed in early stages. So syphilis is relatively easy to cure. So the treatment that is preferred in all stages is penicillin, specifically benzathine penicillin G. What happens is the penicillin kills that bacteria that causes the disease. However, the doctor may suggest another antibiotic for those who are allergic to penicillin. There is an image of what the penicillin may look like if you do receive that medication. What is also great is that it's most likely that you'll only need a single injection of penicillin. And this is recommended for those with primary, secondary, and early latent syphilis if diagnosed with syphilis for more than a year. Additional doses may be needed. So some follow-up treatment that may be needed is periodic blood tests and exams. And specifically for women who may be pregnant, who are pregnant, they will need to get serologic titers that should be repeated at 28 to 32 weeks of gestation and at delivery. Basically, what titers are, if you're not aware, they test to see if your body has made the correct proteins to be able to find syphilis in the future, and therefore your immune system can attack it. Also, it should be known that sexual contact should be avoided until 7 days after treatment has been completed. And also when blood tests confirm that infection has been cured. It is important to note that all forms of sexual activity should be avoided, including oral and rectal sexual activity, especially if they have sores, like the chancres discussed earlier, because those can be very infectious. Again, to reiterate what Erica said, with or without treatment, the sores that are present may take 3 to 6 weeks to be healed. Again, if you do not know this, you can get syphilis again, even after being treated. So you'll want to be open and honest with those who you come in contact with and make sure that you discuss these issues. So as we've been focusing on women pregnant with syphilis, we just want to talk a little bit more about what can be done for treatment there, which you can probably guess is penicillin again. What it does, it prevents transmission of the bacteria to the fetus and treats the fetal infections as well. If allergic, the doctor may prescribe something called penicillin desensitization, which basically is a procedure that will lessen your immune response to that drug so that you can receive the medication safely. All right. So this is about treatment for infants that are born with congenital syphilis and children overall. It's important to note that even if you were treated for syphilis during pregnancy and it came back negative, that the child, after being born, should still be tested, just to be sure. If infants are suspected of having congenital syphilis, they will receive antibiotics. It will, again, be a certain form of penicillin. Depending on the prognosis of syphilis, the infant may need to stay in the hospital and receive intravenous antibiotics for 10 days. In other cases, the infant may only require one injection of antibiotics, just like adults. And then again, we need to make sure that follow-up is being done. So it is important that once an antibiotic is given, mothers are encouraged to bring their children for a follow-up visit to determine if the antibiotic worked by checking for physical signs of congenital syphilis and serological testing, or a cerebrospinal fluid sample every 2 to 3 months for 6 months until the test comes back negative. So you may be asking, well, what is there out there for me if I'm disadvantaged, if I'm homeless, if I don't have the money to go to healthcare to receive treatment and to receive the care that I need for syphilis? What is out there for me? So here are some health services that are located in the San Joaquin County. First, let's just start out with the San Joaquin Public Health Services. So what they do is they provide non-judgmental and confidential STD testing and treatment. They also provide HIV testing and family planning services. And it's important to note that many clients qualify for free services there. An appointment is needed, and we'll go over that information on the next slide. So what's provided in the public health services is they provide case management services for teens who are pregnant or parenting a child. And also participants are linked to nutritional, medical, educational, and psychological services as needed. Also, there's a WIC program, which is Supplemental Nutrition Program for Women, Infants, and Children, provides food vouchers, nutrition education, breastfeeding support, and referrals for health care to eligible women and children. They are also available for pregnant, breastfeeding, and postpartum women of all ages, infants and children to age 5, may be referred to healthcare providers. Also, there's public health nurse home opportunities where they can come for home visits for high-risk families and infants for care, referrals, and coordination, developmental assessments, and parent education. So up there you see Planned Parenthood as well, and they function as they provide pregnancy testing, men's health, women's health, and they will provide education about diseases as well. And also prevalent in San Joaquin County is community CMCs, or community medical centers. They also have that WIC program implemented there. They do infant and child physicals, and they provide that prenatal care that we discussed earlier. And here's that information for Planned Parenthood, San Joaquin Public Health Services, and the CMC location there. There's their phone numbers. You may need an appointment, so please take note of those phone numbers as well. So those are some great opportunities out there in the community that you may qualify, like again said, under San Joaquin Public Health Services for free, some of their free services. It's just important to mention that syphilis is mentioned in Healthy People 2020, which is a national list of health improvement priorities. So it's important to mention it's not just a problem in San Joaquin County; it's a problem in the United States as well. So what the Healthy People 2020 do is they set goals. In section STD 7.1, the goal is to reduce domestic transmission of primary and secondary syphilis among females. And the baseline in 2008 was 1.4 new cases of primary and secondary syphilis per 100,000 females. And the goal was to make that to 1.3 new cases per 100,000. So that was a 10% improvement goal. And similarly, in 7.2, they make a goal of a 10% improvement, which in 2008, males had 7.4 new cases of primary and secondary syphilis per 100,000. So they made the goal to make it to 6.7 new cases per 100,000 individuals. And in STD 8, it was the goal to reduce congenital syphilis overall, which in 2008, there was 10.7 new cases of congenital syphilis per 100,000 live births. And the goal was to knock that number down to 9.6 per 100,000 births, which is a 10% improvement as well. So it's important to remember that syphilis is prevalent disease in San Joaquin County and in the United States, and it is easily treated with antibiotics, especially in early stages. It is important that there are educational and healthcare access, especially those that we mentioned. So please, if you need help, reach out to those places because they can help. It is important that we can establish trusting relationships in the hospital and other healthcare settings so we can be open and honest about this sexually transmitted disease. And in the end, we all just need to stay educated and educate others who we come in contact with about syphilis so that we can protect ourselves and others. Please remember to stay safe and healthy, and thank you guys for joining us today.